Managing my patients' expectations about outcomes of surgery is absolutely crucial. We all have expectations and an idea about anything in life, whether it's going to a restaurant and expecting what sort of quality food we're going to get through the service we're expecting at a particular level of hotel. In the same way, not only would you have expectations about the service my team and myself will deliver, but also you'll have expectations of what you're thinking your outcome of surgery will be. And that's absolutely crucial. And what's crucial is to understand what you're hoping for, understanding what I feel after talking to you and examining you is realistic and I can deliver, and making sure there is no disconnect between those delivery ability and expectation results that mean we can then move on together in your journey, both of us being very satisfied with the outcome achieved. One of the things I always want people to understand is that in plastic surgery, for most procedures, we're dealing in soft tissues. And soft tissues don't have the same predictability of behaviour as, let's say, bone. So if we were to bolt two bones together at a particular angle, we can usually be fairly confident they're going to stay at those angles. Whereas with soft tissues, there's a degree of flexibility, and of course, that will vary between all of us. We will have different genetics, we have different skin quality, different exposure histories to sun and smoking and other factors that will influence how those tissues behave. So it's important, if you're having any plastic surgery procedure, not to feel that there can be too much prescriptive predictability about how your tissues will behave. There's always going to be a little bit of a variation, which is why some people's results will vary even if they've had exactly the same procedure as someone else on consecutive days, for example. In plastic surgery, we always, as plastic surgeons, do our absolute very best to give you the best possible outcome possible. But we can never guarantee an outcome, and that's because there are variations and factors beyond our control. Whether it's due to your genetics, your tissue quality that will be impacted on by age, sun exposure and other factors such as that, through to how your scars form and whether you're a good scar former or a poor scar former, and other factors beyond that. So it's important to understand that plastic surgery isn't a commodity that can be picked off a shelf. We can't guarantee this particular breast or that particular tummy or that particular neck. Instead, we have to work with where you are to start with and within the confines that your natural physiology and anatomy give us. People's satisfaction with their results is very personal and very individual, and it's something I find quite fascinating. We could have someone where, as a plastic surgeon, I may think I've done my best ever job on, and they may be disappointed. And there could be someone else who I think I might have been able to do a bit better, and they'll be delighted. And it comes back to how you're feeling about things and how you're considering things in relation to your expectations. And as a rule, I found that if you're someone after surgery who's looking back at where you used to be and how far you've come, and then are comparing your result, your outcome, with your original old self, then inevitably you're going to be very happy and very satisfied with the outcome of surgery. I think that people who are potentially disappointed or at risk of being disappointed are people who have perhaps an unachievable, idealized future self in their mind, and anything but achieving that idealized future self would be disappointing for them. And I think that's a very good way of thinking about things to make sure that you're going to have realistic expectations and a more guaranteed satisfaction with the outcome of surgery. One of the things I have on my website and the clinic websites and on social media are a lot of before and after photos. But there's one piece of advice I'd like to give everyone when looking at before and after photos. Is don't just look at the afters, look at the befores and compare them with yourself. And if you're not sure about how you may look, have a photograph or two taken of yourself in a similar pose, and then look at your before and find other people whose before photos are similar to yours. Only then can you get a vaguely realistic idea of what sort of outcomes are achievable for someone in your position. There's no point, for example, if you're in your 40s and you've had 3 children, looking at someone in their 20s who's not had children at breast outcomes. So I hope that makes sense, and I think that's a very important piece of advice I like to give everyone when looking at before and after photographs. If the only outcome that you'd be happy with is one of what would be perfection in your mind, then my strong advice is not to go ahead with surgery, because no one can guarantee perfection. I think we can always say better, not perfect. And if you can appreciate and understand that, then we're good to go and can carry on proceeding with our journey. But if perfection is the only thing that would satisfy you in your mind, then I think plastic surgery isn't going to be the right thing for you. The costs associated with revision surgery are variable. If there's a clear, distinct issue that really is something that shouldn't have arisen, then quite frequently there may not be a cost to the surgery depending on the original terms and conditions of the contract. However, there's a big grey area other than that, and sometimes if there's what I would say is a desirable revision from your perspective, but not an essential one or not one that was outside the realms of possibility, then often it may be a full cost of that revision surgery that you'd need to pay in order to go ahead. And sometimes there are areas in between. And I think the important thing is to be open and candid with me and with my team about anything that troubles you, and then we can take things forward in a very open and transparent manner.